Hello, I'm Dr. Joseph Sparano, and I direct the Breast Evaluation Center at the Montefiore Einstein Cancer Center in New York. I am the study chair of the TAILOR-X trial. TAILOR-X is a clinical trial that is sponsored by the National Cancer Institute. Clinical trials are often used in medicine to answer questions about the effectiveness of certain treatments, and are usually performed when there is uncertainty about the best treatment option. This trial is being coordinated by a group called the Eastern Cooperative Oncology Group, also referred to as ECOG, but also includes all of the major cancer clinical trials groups in the United States and Canada. The purpose of this clinical trial is to determine if we can use a new diagnostic test called the Oncotype to make more informed decisions about choosing chemotherapy. This trial is for women who have early-stage breast cancer, cancer that is associated with negative axillary lymph nodes and that is estrogen receptor positive. We know that most women who have this type of breast cancer do very well with hormonal therapy alone. About 15 to 20% will have a relapse of their disease. We also know that we can reduce the recurrence rate by another 5% by adding chemotherapy. In order to produce this benefit, we would need to treat all women with chemotherapy, including the 80 to 85% who would have done well with hormonal therapy alone. In the TAILOR-X trial, we plan to integrate the Oncotype DX test into our decision-making process and determine whether we can use it to identify those who are adequately treated with hormonal therapy alone and those who derive the most benefit from taking chemotherapy. If we are successful, we may be able to eliminate the use of chemotherapy in up to 70% of women with early-stage disease. We hope that we can reduce the need for chemotherapy in early-stage breast cancer. We already know that chemotherapy is not necessary if the recurrence score is 10 or less, and is very beneficial if the recurrence score is 26 or more. These two groups make up nearly 1/2 of all women with this type of breast cancer. For the other half, who have a recurrence score between 11 and 25, we hope to learn whether administration of chemotherapy, now considered the standard of care for this group, is really necessary.